Hello everyone, I am Dr. Aruna Kumari, consultant obstetrician and gynecologist practicing at Cloudnine Bellandur with over 15 years of experience. BP monitoring in the pregnant woman is a very important step because at the first visit of pregnancy, what was her blood pressure, and over the time is the change in the blood pressure is happening or not, we have to monitor carefully. Because preeclampsia is one of the most dreaded complication of the pregnancy, which can lead to almost 5 to 10% of the severe morbidity, and it accounts for 10 to 15% of the pregnancies which are complicated by the hypertension which is arising suddenly. Because of sudden rise in BP, the risk of abruption means internal bleeding, sudden fetal death, or the mother getting seizures and loss of vision, or the brain hemorrhage. These dreaded complications can be prevented by strict monitoring of the BP. So any patient who is having severe pedal edema or body edema is starting suddenly in the late months of the pregnancy, they have to strictly monitor their BP. Ideally in the sitting position with the BP cuff tied and recording every 4th hourly after the patient is relaxed and calmed for 10 minutes is the ideal setting for the recording of the BP. So sometimes what happens, we think that the patient is anxious, as soon as she comes to the hospital BP may rise. But for those kind of patients, we do tell them to strictly monitor the BP. So monitor chart every 4th hourly at home, they can recording, and if any BP is more than 140/90 or the patient is having symptoms like headache, sudden uneasiness, these things, they have to contact their doctor immediately to prevent the dreaded complication of eclampsia. Sudden fits can occur and internal bleeding and sudden fetal deaths. These can be prevented by strict monitoring of the BP in the late trimesters, and immediately post delivery also BP monitoring is very important, because we think till now everything has gone fine, but post delivery there have been instances where the BP suddenly shoots up and eclampsia means convulsions patients getting. So this is the importance of BP monitoring in pregnancy, and everybody should be aware, and if any disturbance or any sudden uneasiness if you are feeling, meet your doctor immediately to prevent the further complications.